Hello, everyone, and bonjour à toutes et à tous. And as usual, I'll start with the latest numbers on COVID-19 in Canada. There are now 70,342 confirmed cases, including 5,049 deaths, and 33,254 cases, or 47%, have now recovered. Labs across Canada have tested over 1,145,000 people for COVID-19 to date, with about 6% of these testing positive overall. We're now testing on average of 26 to 28,000 people daily. These numbers change quickly and updated regularly on canada.ca/coronavirus. Last week, I mentioned the disproportionate impact and severe outcomes of COVID-19 on our seniors, particularly those residing in long-term care and assisted living facilities. An estimated 20% of Canada's COVID-19 cases are linked to long-term care homes, but over 80% of all deaths are among seniors residing in these settings. I reiterate these numbers today because not only do they lend a voice to the unspeakable scale of the impact on our seniors, but they also highlight the challenges faced by healthcare staff working in these settings. Among these are the nurses we are celebrating this National Nurses Week, but also the personal support workers and the many other essential staff that deliver care and services to our elders, parents, and grandparents. In our long-term care homes, healthcare workers not only deliver health and personal care services, but they establish familiarity and friendships, offer companionship, personal interaction, and simple human kindness that is as vital to well-being as any medicine. During COVID-19, their work has become immeasurably harder. Nevertheless, they have shown up, and despite staffing shortages and facing their own fears, they've worked long hours, taken extra shifts, and in some cases isolated from their families. And tragically, some of the least compensated and recognized among these, including personal support workers, orderlies, and patient attendants, have lost their lives due to complications of COVID-19. Remember, on this 200th anniversary of Florence Nightingale's birth, shine a light in your window to thank our nurses for the valuable work they do, but make it extra bright for all those who work alongside them around the clock to be there for us when we need them most. Thank you. Merci.
Bonjour. Comme d'habitude, je commencerai par les derniers chiffres concernant la COVID-19 au Canada. Il y a maintenant 70 342 cas confirmés, dont 5 049 décès et 33 254 personnes rétablies, soit 47 %. À ce jour, les laboratoires de partout au pays ont testé plus de 1 145 000 personnes pour la COVID-19 et environ 6 % d'entre elles ont reçu un résultat positif. En moyenne, nous testons actuellement de 26 à 28 000 personnes par jour. Ces chiffres changent rapidement et sont mis à jour régulièrement sur le site canada.ca/le coronavirus. La semaine dernière, j'ai mentionné les conséquences graves et disproportionnées de la COVID-19 pour nos aînés, surtout ceux qui vivent dans les établissements de soins de longue durée et les résidences d'aide à la vie autonome. On estime que 20 % des cas de COVID-19 au Canada sont liés à des établissements de soins de longue durée, mais plus que 80 % de tous les décès sont recensés chez les aînés vivant dans ces endroits. Je répète ces statistiques aujourd'hui, non seulement parce qu'elles traduisent bien l'ampleur indescriptible des conséquences pour nos personnes âgées, mais aussi parce qu'elles mettent en évidence les difficultés auxquelles sont confrontés les travailleurs de la santé œuvrant dans ces établissements. Parmi ceux-ci, il y a le personnel infirmier que nous célébrons en cette semaine nationale des soins infirmiers, mais aussi les préposés aux services de soutien à la personne et les nombreux autres employés essentiels qui fournissent des soins et des services à nos aînés, parents et grands-parents. Dans nos établissements de soins de longue durée, les travailleurs de la santé ne font pas qu'offrir des services de santé et de soins personnels, ils créent une certaine familiarité et des liens d'amitié, offrent de la compagnie des interactions personnelles et de la pure bonté humaine, qui sont aussi essentielles que n'importe quel médicament. Pendant la pandémie de la COVID-19, leur travail est devenu immensément plus difficile. Néanmoins, ils ont répondu présents. Et malgré les pénuries de personnel et leurs propres craintes, ils ont travaillé de longues heures, ont fait des quarts supplémentaires et, dans certains cas, se sont isolés de leur famille. Et tragiquement, certains de ces travailleurs, ceux qui sont les moins rémunérés et reconnus, dont des préposés au service de soutien à la personne et des préposés aux bénéficiaires, ont perdu la vie en raison des complications de la COVID-19. En ce 200e anniversaire de la naissance de Florence Nightingale, n'oubliez pas de faire briller une lumière à votre fenêtre pour remercier nos infirmières et infirmiers du précieux travail qu'ils font. Faites que cette lumière soit particulièrement brillante pour tous ceux qui travaillent à leur côté 24 heures sur 24 afin d'être là pour nous lorsque nous avons le plus besoin d'eux. Merci.
Okay, thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we ask that you make your way over to the freestanding mics. Operator, over to you.
Thank you. Please press star one if you have a question. Appuyez sur étoile 1 maintenant pour poser une question. Notre première question est de Micheline Laflamme de Radio-Canada. À vous la parole. Please go ahead.
Oui, bonjour. Le Conseil national de la recherche et CanSino Biologics collaborent en ce moment pour développer un vaccin. Alors, est-ce que vous considérez que c'est une entente qui est importante entre le Canada et CanSino, une entente qui pourrait faire la différence? Et savez-vous s'il y a des essais cliniques là, qui vont commencer bientôt et où ça aura lieu, si c'est le cas?
Merci pour la question, c'est Dr. Njoo. Oui, je pense que l'entente, c'est un bon exemple vraiment de la collaboration des scientifiques partout dans le monde et c'est une entente importante pour le Canada. C'est un vaccin candidat. Il y a plusieurs vaccins candidats, mais on a toujours l'espoir que ce vaccin candidat peut être, on peut avoir des résultats positifs. On n'a pas les détails pour les prochaines étapes, mais c'est quelque chose qui va dérouler bientôt avec les chercheurs au Canada. Mais pour l'instant, c'est vraiment des bonnes nouvelles pour le Canada, mais aussi pour la recherche pour trouver un vaccin partout dans le monde. Merci.
Puis votre suivi, Micheline?
Oui, merci. J'aimerais peut-être revenir sur la question des tests parce que j'entendais, là, vous dites qu'on est à peu près à 26 000 tests à travers le pays. Pourtant, il y a même peut-être 2 semaines de ça, le premier ministre disait que notre objectif, c'était 60 000. Et je comprends là que s'il faut tester au bon moment, au bon endroit, la bonne personne, mais quand même, qu'est-ce qui fait en sorte qu'on soit presque à 30 de ce qu'on espérait atteindre alors que les provinces commencent à changer leurs mesures, là, à avoir moins de confinement, qu'on est en train de déconfiner, excusez-moi.
Oui, merci pour la question encore. Oui, si on parle de 60 000 dépistages par journée, tests par journée, c'est toujours, comme on dit, la capacité des laboratoires, mais il y a toujours plusieurs étapes. Il y a aussi comme on dit, la réalité ou peut-être même des défis sur les trains pour chercher, pour rendre accessible aux patients le dépistage et après peut-être le transport au laboratoire. C'est un enjeu actuel. Quand on discute avec nos homologues des provinces et territoires, c'est quoi peut-être l'approche, une approche stratégique à travers le pays. Et c'est sûr que tout le monde est d'accord que c'est sûr que toutes les personnes symptomatiques doivent être testées. Et c'est aussi quelque chose qui a évolué parce qu'au début, avec l'expérience limitée, vraiment peut-être au mois de janvier, on pensait que, OK, peut-être que c'est seulement les personnes avec les symptômes comme un toux ou une fièvre. Mais maintenant, on voit qu'avec l'expérience à travers le monde, mais aussi ici au Canada, qu'il y a toute une gamme des symptômes. Donc, je pense qu'avec nos homologues, on pousse aussi, on respecte maintenant, comme dit, le jugement des médecins, les cliniciens sur le terrain. Si on suspecte n'importe qui avec n'importe quel symptôme, peut-être avoir le COVID-19, c'est bon de tester cette personne. Donc, ça, c'est numéro 1. Maintenant, pour les personnes asymptomatiques, on discute que c'est une bonne idée avec notre approche que s'il y a une personne déjà confirmée dans un environnement comme un établissement de soins de longue durée, déjà confirmé avec la COVID-19, c'est une bonne idée de vraiment avoir des tests partout, peut-être pour tous les autres résidents et aussi le personnel dans l'établissement. Ça, c'est numéro 2. Aussi, peut-être, s'il y a une cas dans la communauté, il faut peut-être tester tous les contacts domicile à la maison qui sont en contact avec le cas confirmé. Maintenant, un enjeu actuel, c'est on voit que quelques provinces sont en train peut-être de faire comme des initiatives peut-être pilotes, peut-être dépister dans les certaines environnements avec à haut risque comme les établissements de soins de longue durée, même s'il n'y a pas, comme dit, un cas confirmé à date. Ça, c'est l'approche et au fur et à mesure, je pense que toutes les provinces continuent de augmenter leur capacité pour dépister. Et c'est sûr que la situation peut-être au Québec, c'est différent comparé à Colombie-Britannique ou même les territoires. Donc, c'est quelque chose que, en fin de compte, c'est vraiment les autorités sanitaires de chaque province et territoire qui sont responsables et sont dans une meilleure position pour voir qu'est-ce qui est nécessaire de faire sur le terrain. Merci.
Merci. Prochaine question.
Our next question is from Lieber Thiaume from the Canadian Press. Please go ahead. À vous la parole.
Yes, thank you. This question is for Dr. Tam. The Deputy Prime Minister said yesterday that traffic between the U.S. and Canada is bound to increase as states and provinces reopen. And we're wondering, from a public health perspective, as traffic does increase across the border, what measures do you think are needed to keep Canadians safe that are not currently in place?
Well, I think one of the key aspects is to continue to strengthen what is in place because right now we, ask that travelers undergo a mandatory quarantine as they come through our international borders, which is, I think, one of the key aspects of the public health measures in order to reduce any risk to the Canadian population. So that, I think, is one of the key aspects of it. A whole host of measures in terms of making sure, I think, that if the numbers do increase, that there is an actual public health system capacity then to be able to follow up and do the proper follow-up of any of the travelers. So I think it is something that we'll have to watch really carefully so that it is not an issue that's going to overwhelm our public health capacity in order to be able to do what we need to do. But I think right now things are working really well. So I think it's watching those volumes as things change over time.
And as a follow-up, if I understand correctly, you previously said that the public health officials are not tracking the number of cases linked to cross-border travel from the United States. You can correct me if I'm wrong. If you do have some numbers, that would be great. But if not, what are the challenges for doing that? You kind of referenced that this is going to be important. What is the main challenge for addressing that shortfall or gap, if you will?
Well, I think we do track, travel-related cases, particularly in the province and territories. And we have seen that travel-related cases have really fallen off as a result of all of the border measures. So I think it's the ability to, of course, detect any of these cases that's important in any sort of efforts to reopen our economy, as it were. So I think some of the capacity that we've talked about in terms of, the ability to test, track, isolate, and quarantine are still the key cornerstones. Right now, anyone who comes in, provided with a mandatory quarantine order, they have to specify the plan that they have to suitably quarantine as well. Of course, symptomatic people are immediately isolated. And of course, then we track anyone who's actually isolated at the border. But those who are asked to go into mandatory quarantine have a plan to do so. And if they had developed any symptoms, of course, they'll be followed up by local public health. We're also doing, following up to make sure people are complying with the orders as well. And that includes collaboration with our peace officers and others. So, all of that foundation is there as we begin to see if there's any increase in volume.
Thank you, operator. Next question on the line.
Notre prochaine question nous vient de l'inaudible de la presse canadienne. À vous la parole, please go ahead.
Yes, hello. Dr. Tam, my question is for you. I was wondering, at this point, what is your scientific advice to the government about reopening or not the border with the United States at this point?
So I think, as with all aspects of this next phase, is extreme caution and really be very, very careful because this virus could take off rapidly if we do not be extremely slow and cautious with our approach. That's any aspect of domestic or international sort of easing up, if you like. I think that one of the sort of underlying principles with provinces and territories is that we need to be able to see what happens when we ease the domestic public health measures before we can essentially look at the international border easing up. So that's another principle that we have discussed with the provinces and territories. And of course, having the ability to, again, to detect and trace contacts, quarantine and isolation are still, very important, and looking at our health system capacity. But it also depends on us tracking the international epidemiology, because the virus is in essentially all countries and jurisdictions of the world, and they're all at different stages in the epidemiology. So part of that will be looking at that aspect of what's going on in the other country. And of course, the United States being one country that still has cases and is still trying to manage outbreaks. So, and they present a risk to Canada from that perspective. So we have to take that into account.
Thank you, Lena.
Okay, yes, thank you. Well, you know what? You gave me enough on this. My follow-up would be on testing. So at one point, not so long ago, like a day or two ago, you were saying we should not be testing too much because we're going to get false positives. We shouldn't be just testing at random. And now more and more people are saying, in different provinces, are saying we want to test more. We want to test non-symptomatic people. We want to test in the community. So has your thinking around that changed? Should we be testing more as long as we have the tests? Should we be testing more?
Well, I think as things and public health measures ease, we know that we have to have the ability to rapidly detect and cases and deal with contact tracing. So that capacity must be there. So I think we have to right now we're having an active discussion in provinces and territories as to, well, what more can you do on top of the diagnostics and case and contact tracing, which has to be absolutely paramount. Is there areas such as high-risk settings like long-term care facilities where some jurisdictions are looking at more of a screening approach, such as what Ontario is doing right now? So some of these aspects are being actively discussed. But on the whole, one of the key strategies is to widen the symptom list, if you like, and be able to test anyone who has mild symptoms. That is casting the net a lot wider than, of course, in the middle of the epidemic, when we essentially asked people with mild symptoms to stay at home and wait out their symptoms, and many of them were not tested at that stage. And so in this next phase, the initial increase in testing is going to be focused on that aspect.
Thank you, Dr. Tam. We'll now come to the room for the next question. Mackenzie?
Hi, doctors. Mackenzie Gray from CTV News. One of the things that government departments, airlines, lots of other businesses are looking at doing now to determine whether or not people are ready to go back to work is taking their temperature before they come into the store, go into work. Can you speak to the effectiveness of whether or not someone's temperature is a good indicator of whether or not they have COVID, and whether or not it will help us be able to detect people who have asymptomatic cases of the virus?
Yes, I can comment. So maybe going backwards from what you just said, if someone's asymptomatic, obviously a temperature check is not going to detect anyone who's asymptomatic or pre-symptomatic. And people can also have very vague symptoms that, that doesn't include a fever, for example. So those people will obviously not be screened. And so then you're left with potentially someone who with an actual higher temperature. So that at that point, if you had someone with high temperature, you can't tell at that moment in time what that higher temperature is due to. But you can certainly turn people away as a result. But I think some follow-up may need to be done, because people can have a higher temperature for all sorts of reasons, whether naturally, and they're well, but their temperatures go up and down as a result of different activities or their different health conditions. So it's not a very specific means of screening, of course, as you can imagine. And it's not very sensitive because of the nature of the illness. So those kind of characteristics have to be borne in mind, because it's very difficult to interpret that one way or the other.
My other question is about seniors' homes. Obviously, you guys have mentioned this on a number of occasions. What concrete things would you like to see seniors' homes, long-term care homes, any facilities where we have vulnerable people living there? What would you like to see them do as we go on the downward cycle of this wave and potentially going into future waves, so we don't see the large spikes that we've seen in these homes?
Yeah, so I think from our perspective in working with the chief public health officers or medical officers of health is to put down some guidance which do have to be implemented by the different facilities in terms of prevention, really. The key is to prevent the entry of the virus, which is, can be quite difficult because of the asymptomatic and pre-symptomatic infections. So some of those guidance also include the use of PPE, for example, for staff for the whole shift that they're there, because you actually are trying to prevent introduction by staff, between staff, and also essential visitors or visitors to the care facility also has to practice infection control measures. But of course, people like to focus on the PPE, but there's all the other controls, the administrative controls and who goes in and out, tracking who they are, the physical controls of spacing. So, I think no congregate settings or, having meals without physical distancing. The activities have to change within those long-term care facilities so that the spread doesn't occur. Environmental cleaning, all of those aspects are there to try and prevent the introduction. But the other administrative and support that provinces are beginning to, it's try and stick to one single facility for staff working there, which has been a bit of a challenge to do because many of the staff, because of their relatively low-paying jobs, they're actually working in between different facilities or between the facility and an acute care and a home care setting. So they're trying to reduce that so that that spread channel doesn't actually occur. So it's really in multiple layers that needs to be done in order to support long-term care. The moment you detect a case, and Dr. Njoo just spoke to that is where low threshold testing of everybody, including asymptomatic people, I think, then becomes extremely important.
Thank you, Dr. Tam. We'll go to the line for one final question. Operator?
Thank you. Our last question is from Rahul Vidyanath from the Epoch Times. Please go ahead.
Yes, thank you very much for taking my question. I would just like to ask you, how critical is the shortage of vital medicines at this point in time? And I understand it's getting worse. And what can Canada do to protect its supply chain of vital medicines, including diversifying it away from Chinese production, which has something like a quasi-monopoly on the manufacture of active pharmaceutical ingredients?
Thank you for the question, and I might not be in the best position to answer that, but I know that our Health Canada colleagues monitor and facilitate the sort of constant discussions with the province and territories on any signs of any kind of drug supply or essential supply issues from that front. So I know that there are mechanisms through which they are monitoring this very closely, and I think they're looking at different strategies. Just as we have with public health supplies like lab supplies or PPE in the healthcare sector, I think exploring all options, including domestic capacities, is part of the approach as well.
Thank you. And your follow-up?
Thank you. And we've obviously heard many reports of receiving faulty PPE from China, not just Canada, but other countries. But what is your level of concern about the actual medicines that are being made there, given that you can't do on-site investigations during this pandemic?
I think, again, any details, I think I would defer to our Health Canada regulatory colleagues. Of course, Canada has a robust regulatory regime, and that is there to ensure that medicines meet certain standards and requirements. And I know that Health Canada colleagues collaborate with other international regulatory authorities as well, whether they be the European Medicines Agency or the US FDA. So they have different mechanisms to try and ensure that Canadians get safe and effective medications.
Okay, apologies, doctors. We're going to come back to the room for one last question.
Hello. Sean Kilpatrick with the Canadian Press. We're seeing this term, the new normal, being thrown around. I'm wondering what both of you see as what the new normal is going to be.
So I think it's the recognition that we have not eliminated this virus, and that it is in all countries in the world. So we also are looking towards things like serological surveys to see how much of the population maybe have been infected with the virus in the past. But I would suspect, just based on international surveys so far, that percentage is going to be relatively low. So there's going to be a lot of unimmune people in Canada. So the new normal means that we have to be extremely cautious about relaxing public health measures. And provinces are phasing their relaxation of certain measures according to their own context and epidemiology. So I think the pathway to this new normal has to be extremely cautious, where you have to monitor what actually happens and evaluate what happens when you do that. But the new normal means that Canadians, every one of us, must continue to observe some very core public health practices, which one of the most difficult is staying home when you're sick. And I keep saying that isn't sort of in our general behavior before this actual pandemic. And people need to be supported to do that. Washing your hands, we cannot talk about it more often. The physical distancing means that we are not going to see mass gatherings anytime soon, not until we have a very good handle on what is going on. And provinces are continuing to look at their advice on maybe small gatherings, particularly ones of importance to the cultural, social context of Canada, but doing those small gatherings in a very safe manner. So you have to actually change your approach to some of those gatherings. Going outside is okay, but you still maintain your own little cluster or bubble, but a distance from others. That's still going to be there for a while. Non-essential travel, we're not going to see that happening. We hopefully are capitalizing on what we learned about telemedicine, telework, so that workplaces could look very, very different in this new environment. And you will see grocery stores with the social distancing measures, plexiglass to protect workers, etc. So I think that's very important. So I think a lot of what fundamentally characterizes Canadian daily lives will not look the same as before, as I said, before January of this year. And so listen really carefully to your local public health authorities.
Your follow-up?
Yes, my follow-up is just in the near future, you talk about us having to move slowly. How slow can we move and it not affect mental issues and economic issues?
I don't think there's an actual measurement for the, it's not like a car where you sort of have to look at how many kilometers an hour that we can drive. I think different provinces have very different situations right now. So if you are in the Yukon or PEI, you're quite different from if you're in Vancouver, where you can see the medical officers of health being very cautious about what it is they do. They have phased approaches. Each jurisdiction have certain phases according to their context. If you're in Montreal, you're in a very different position right now. You're still dealing with outbreaks while cautiously looking at what is happening in the community. And the rest of Quebec is different to Montreal. So I think the rate at which certain public health measures are eased will fundamentally depend on where you are in Canada.
Thank you, doctors. That concludes today's conference.